Can you give me a more definitive definition of the difference between the? I think you said it probably all, but
gingivitis is an inflammation of the gum tissue. And there's the crevicular, there's the crevicular fluid. There's the sulcus. Okay, if you envision a tooth, and you envision the gum tissue as a turtleneck that goes around. It's like a collar that goes around the tooth, and there's an predictably and supposedly impenetrable layer called the crevicular, the crevicle, the crevicular fluid, and it's the gingival sulcus. So the gingival sulcus comes in and it bonds to the cementum of the tooth, and it's a barrier. It's like the endothelial barrier. It's like the blood-brain barrier. It's like the lung parenchyma barrier. And once the gingiva is just an inflammation, or gingivitis is an inflammation of that tissue, but it doesn't go beyond that gingival crevice. Once it goes beyond that, then there's bone loss, and there's Porphyromonas gingivalis. There's all kinds of treponema, different bacterium that go subgingivally into the circulation and go directly to the to produce C-reactive protein levels and increase cytokine response. So gingivitis is reversible, and periodontitis is not so reversible. It has to be treated.
Got it. That was very useful. So Wayne asks, what are the upsides and or downsides of rinsing one's mouth with hydrogen peroxide?
It's beneficial because it's a peroxide. It kills, it oxidizes bacterium and viruses and treponema, all the bacterium that reside in the gingival sulcus. But I think there's what we use. We use a silver hydrosol Argentin 23 formulation, which is a nanotech colloidal silver, or we use HOCl, which is a product of that called Oxymist, which is what your white blood cells, your immune system produces in a cytokine, to prevent a cytokine storm. So peroxide is useful and it's helpful. It kind of whitens your teeth a little bit, but it has to. If you're going to use peroxides, you have to make sure that it's 3%, not 15%. You have to dilute it down so that it's food grade peroxide level.
Tom, is there a danger to using the peroxide every day from the oral microbiome perspective?
So, yes, I think there is, particularly if you're not using 3% peroxide level. I think what we do in our practice is we use the HOCl because that's much more on the same level as your immunoglobulins and your reactive immune cells. What your HOCl is what your white blood cells produce.
So let me ask you this question: is the HOCl in your dental product?
Yes, it's called Oxymist.
Okay.
We use it as a mouth. We use it as a mouth spray, as a nasal, intranasal, intraoptic, intraotic. We use it for gingivitis. We use it for periodontitis, and it kills H1N1. It kills cytomegalovirus. It kills SARS-CoV-2, and it kills TB. So we started using this product, this HOCl, to disinfect our countertops, and my wife uses it to disinfect vegetables when she comes back from the store.
Yeah, so this is hypochlorous acid.
Hypochlorous acid. Now there's another similar product called MMS, which is Miracle Mineral Solution, which I think is a Jerry Tennant product. But that we believe that the HOCl is the closest to biomimetic naturopathic response because your WBCs produce HOCl in the presence of inflammation.
So Tom, just so I don't get it wrong, but since you're kind enough to help us tonight, the way you get your Oxymist or other products is what's the website? www.pearloralhealth, right?
Pearloralhealth.com.
So I'm putting that in the chat so everybody to see. So pearloralhealth.com. The other
It's very
question.
inexpensive, and it comes in a 2 ounce and an 8 ounce. And if you're going to get on an airplane, for example, or if you have to, this is what I tell my patients: if your kids, and we have this thing in Tennessee that drives everybody nuts because wearing masks is just plain stupid. But particularly for our children. But if you're going to have, if the mandates are saying that your children have to wear masks, then you take the mask off and you spray the HCl inside the mask, so you're not rebreathing all of the pathogens that you're rebreathing when you're breathing into the mask.
Right.
So that's a function. We spray it on. Like I said, we use it. We've been using it for years to disinfect the counters in our practice because it kills TB. If it kills, and it's FDA approved to kill TB, and if it kills TB, it kills all pathogens.
Tom, Linda, who attends a lot of our talks, has a question, but if it's more complex, you can defer it to when you present.
Okay.
But she says the problem is if one has root canal teeth, it leaves a hole in the mouth. What should one then do if there are many root canals? And I know that can be a complex
Great question. Great question. We see this every single day. People come in because people ask me, why do dentists restore teeth with root canals when they're known to be infected? It's an infected process. And my answer is, and it may make little sense, is that dentists have been trained to save teeth at all costs. And so endodontic specialists will treat a root canal. Basically, it goes like this. I have a cavity here. I have a hole in my tooth. And so you put in a filling, you put in a pulp cap, you try to save the pulp. The tooth goes through an infected process. You say, okay, now we need, now it's hurting and aching. So let's do a root canal. And then the root canal leaks. The oxygen levels decline. The mineral content, the voltage declines in the cellular membrane, and the body, and then it becomes infected. So what you have is a septic system inside your mouth next to your brain, which is not a good idea in my opinion. And so we recommend that, first of all, number one, you don't do root canals. And there's a film that I recommend you people watch. It's called The Root Cause, made by Dawn Ewing. She's a friend of mine in the IABDM, the National Association of Biological Dental Medicine. And it's a great film. It shows the perils of root canals. But basically, root canals are because once you kill the pulpal chamber, there's hundreds of miles of microdental tubules that go from the cementum of the tooth into the pulp chamber that transmits fluid and lymphatics and blood and mineral content. And once that gets shut off with a root canal, then then the voltage decline, the cellular membrane declines, and the oxygen levels decline, and then the pathogens, the pathogenic bugs come in and they set up housekeeping. And then the body tries to wall it off. But every time you chew on a root canal tooth, even if it doesn't show up on a CT scan, it's infected. But if you chew on that, you send a pulse of the bacterial toxins into the systemic circulation, into the liver, increases C-reactive protein, and then it produces cytokines, and your body doesn't really care where it is. It just increases the cytokine storm, and now now you're infected.
So Tom, chewing is actually a toxic pump when you have a root canal.
It's a detriment. Correct.
Wow.
And then your tooth. There's a ligament called the periodontal ligament. It's like a sling. Okay, it's like a bumper. And once this becomes infected, your tooth raises up a little bit into the socket, and then it becomes out of occlusion, and you're banging on this thing, and you're creating more of a problem for periodontal disease and for heart disease. And Thomas Levy, who's a board certified cardiologist, and Stephen Sinatra, who's a cardiologist, will tell you that if you have root canals, that you are, and or periodontal disease, like you were talking about, Tom, if you have either one of those, you have a much greater chance of stroke, cardiovascular disease, heart attack, anything cardiovascular disease. rate goes up precipitously.
A question is, what do you think about laser dentistry for gum disease and root canal infection therapy?
I think it's great. I think it's a good way to go. I would recommend, first of all, don't do root canals. But if you have to do a root canal, because as a board certified DDS and anti-aging guy, I have to tell patients, look, if you want to save the tooth, that's up to you. But I'm not going to recommend it. But I'd like to watch this film called the
root cause.
Thank you. And if you, like I said, most dentists have been trained to save teeth no matter what. And what I'd rather have you do is take out the root canal tooth and just surgically remove it, scrape the periodontal ligament. We have oral surgeons that are trained to do this. Scrape the periodontal ligament, do a PRF or a PRP procedure, protein-rich fibrin, protein-rich plasma procedure, where they take it's your stem cells from your blood, and then they repack the socket. And you can do this with third molar extractions, or you said if you have a lot of endodontic teeth that are involved. And we have people that have multiple root canals that are sent to our surgeons to have the root canals extracted, and then they do the scraping of the periodontal ligament that gets rid of the stem, so that the socket can fill up with bone. And then we do the PRP or the PRF procedure, and then we ozonate. We use ozone to kill all the bugs, because that's an oxidative burst that kills all pathogens. And then we suture that up, give it about 4 to 6 months, and you can laser that too. Laser therapy is used we use laser therapy for tongue tie releases mainly, and for once somebody has a periodontal implant put in place, sometimes the tissue will grow over the implant margins. So we use laser. We use a diode laser to circumscribe around the implant to reduce the tissue level so that we can get a good impression. But laser technology is good. Ozone is fantastic because it kills the bugs and it helps in the healing process. Ozone will increase endothelial nitric oxide synthase, which will help with the endothelium, which will help with nitric oxide release and healing.
So I have a question. Someone asked about, what if they don't want to remove the root canal tooth? What can they do? I think you kind of addressed
Well, okay, that's a great question. If they don't want to, if they're just absolutely against it, and like I said, as a board certified DDS, I have to tell them, okay, well, if you're going to keep the tooth, then ozonate it. Then make sure that if it's abscess, and there are some root canal teeth that are not disastrous. So let me put it that way. But most of them have lesions after a while, and they're all infected, but some to a lesser degree or a greater degree. But if you're saying, and a lot of people say, well, I have to think about this, or I have to get my money together, or boy, that's a big deal, or it's a front tooth, or whatever. But after you watch this film, The Root Cause, you're probably not going to want to, have that tooth retained in your mouth. But if they want to keep it in, what we recommend is a series of injections, of ozone injections that are placed right into the periodontal ligament, and we do this daily. In fact, today I just injected somebody in their tonsillar region, because she said I have tonsillitis, and so I said, well, you know what? I've injected all kinds of joints and ligaments and TMJs and teeth, and I said, but I haven't done a tonsillar ozone therapy yet, and so we did that today, and it worked pretty well. She's going to let me know in the next few days how she's doing.
Tom, was TMJ titrated back to the periodontal disease of the gingivitis?
I would say not so much, Tom. That's more of a skeletal issue, although it can be. That's more of a condylar placement issue, because it's like a ball. The TMJs are like a ball and socket joint, and it's like a bilateral ball and socket joint. Imagine this. Here's what I tell my patients. Imagine that your knees are connected together. They can move sideways together. They can move down and forward and outward, and then back and forth, and then back up into the knee socket. And you're like, wow, that's pretty complicated.
That's triple jointed, yeah.
That's what your TM joint is. So what I look at in my practice is I look at, first there's dental issues. There's there's not enough room for teeth in developing children, in which we do arch expansion therapy. And then there's skeletal problems where you have a class 2 or a class 3. And there are very few surgical cases that I don't recommend people go to surgery for a skeletal class 3 or a skeletal class 2. But, this is class 1. I don't know if you can see it. This is class 1. This is class 3, the typical Chihuahua bite. These are your maxilla incisors. And this is a class 2, where a kid walks through the door and 5 minutes later his chin comes through. You know what I mean? And so those are skeletal deficits, skeletal deficiencies, and those have to be corrected early. We like to correct those early on, starting about the ages of 5 to 6. We put them in orthopedic appliances, expand out the arches, and then wait till the teeth come in, and then do orthodontic brackets. Like I said, I do a lot of orthodontics in my practice.
Right. The next question is, what would be your top 3 things we could do at home to improve our oral and our body health?
Minerals, pH, which is minerals, probiotics and prebiotics. And in the mouth, we all know that the disease starts in the gut. But where does your gut start? Your gut starts in the mouth, and we've isolated the gut microbiome, or I'm sorry, the oral microbiome. And there's two probiotics that are essential. And so minerals, psyllium, concentrated minerals, trace and macrominerals. But then there's Streptococcus salivarius K12 and there's Streptococcus salivarius M18, which sounds a little bit like a Honduran hit game. But and they're made by the Bliss Company. And so you can get them through our website. Life Extension carries them. One's called Throat Assist, the other's called Oral Hygiene Assist. We're going to put them together along with L-Reuteri and some other essential probiotics into a lozenge that will just help you with flu, sore throats, strep mutans, which is basically the bacterium that causes dental decay. And so we're going to put that in a lozenge. So, and then just using a Sonicare. You get a Sonicare toothbrush and then use our paste, because our paste has a lot of proprietary ingredients in it.
So with cavitations from wisdom tooth extraction, must you have oral surgery to resolve it, or is there a non-invasive treatment?
Yes and no. Great question. It depends on the extent of the apical infection. Sometimes, if you do, what we do is preliminarily we do a panoramic orthopan film, which gives us the full frontal assault on the face. So we can see the condyles, we can see the third molar extracted, because a lot of people have had their third molars extracted. And we can kind of get a general idea, or we can do a periapical film or a bite wing film, but a periapical film where we zoom in on an extraction. So think of it this way. An osteocavitation is kind of like, it's an osteomyelitic formation in the bone. It's like dead, smoldering bone. And they're hard to diagnose. They're very often asymptomatic, so that you can't really get a really fun, people come in, and I go more by the tooth meridians. And let's say there's a smoking gun or an osteomyelitic osteocavitation in the third molar region on the right side. And I'll say to that person, so do you have any cardiovascular conditions? And they go, yeah, how'd you know that? They go, well, because this meridian here, where you have this osteocavitation, is directly related to your heart meridian and a few other things. And so in traditional Chinese medicine, there's the connection between the meridians and the organ systems and some of the spinal nerves and some of the cranial nerves. So, and I think I'm getting off track here a little bit, Tom, but the osteocavitation. So basically, if we can diagnose from an orthopanomograph film or a periapical film that somebody has an osteomyelitic cavitation, then we send them off to our surgeon for what I described before is cleaning out of that socket. And I think your question was, does it need surgery, or are there other things you can do? So if it's a big lesion, then, or a big enough lesion, we go in and we open it up and we do the surgery. or if it's not that big of a deal, we can hit it with we'll go with the 3 to 7 to 14 ozone injection. We just go deep into the bone. It's not particularly painful, believe it or not, because the bone is kind of like mush, and you can kind of go in there. We use a really small 31 gauge needle with 3 mils of ozone that we make from our ozone generator at about 40 gamma, and we just inject into the osteocavitation. But it takes a number of times, and as it heals, the ozone will kill all the bugs, all the pathogens. It'll increase enos, so it increases the microvasculature, so it brings in more nutrients. So we use a combination of both. So we'll send them to our surgeon, or our oral surgeon, or our implant surgeon. And I think, I don't know if I answered your question on implants. Typically, what I like to do with implants is I like to use ceramic implants, not the titanium metallic implants, because, I mean, it's good to have an implant because you want to keep your teeth separate so you can clean each tooth. You know, they're fixed bridges, they're removable partial dentures that you can use, and they all have advantages or disadvantages.
Let's see.
Did I answer the question okay?
I think you covered it all, and I am recording so people can hear this later when I publish it, if that's okay with you. How often is tinnitus associated with periodontal or root canals?
I'm sorry, say it again, Tom.
Tinnitus, is there an association to oral health?
No, that's more of a metal thing. If you've got a bunch of that's more of you've got a bunch of mercury fillings, you've got a bunch of metal-based crowns, and crowns we call them porcelain fused to metal crowns. They appear porcelain, but if you look and you've got crowns in your mouth or crowns in your patient's mouth, just take a look at their mouth and look around at the back side, the lingual side of their crowns, and if you see a big metal strip, that's a porcelain fused to metal crown. And so tinnitus is more of a function of. I'll just tell you a little story. I had this guy. His name was Alan. He came in a couple of years ago, and all he had in his mouth was one porcelain fused to metal crown. Which, and when I say that, it's a metal understructure with a porcelain on the top of it, so it looks like porcelain. And so we took the crown out, and he says, "I want to get all this metal out of my mouth, and I only have one crown." I said, "Well, you know, it should be simple enough." So we took the metal crown out, and within about 5 minutes, Alan goes, "Oh my God!" And I go, "Alan, what's wrong?" He goes, "Oh, I didn't tell you this, but this ringing in my ears just went away." I go, "What are you talking about?" He goes, "I had this ringing in my ears for how long?" It was for 10 years. And he goes, "And it just went away. It's gone." And I go, "Well, that's pretty cool." So we impressioned it, and we made him a new crown, and we temporized it. And I said, "Is it, how's it doing?" It's still gone. Comes back 2 weeks later to have the crown placed, still gone. So that tends to be more of a metallic function, and mixed with 5G and all kinds of issues there. That's a whole other topic.
Excellent answer, Tom. Very informative. Someone has, what is it, Sogans Syndrome. She suffers from dry mouth and her teeth seem to be rotting. What would you recommend?
Sogans Syndrome?
Sogans Syndrome, yeah, and dry mouth and rotting teeth.
Well, there's okay. Those are 3 separate functions. The rotting teeth is a dysfunction in the dental fluid transport system. There's 2 guys named Lenora and Steneman who had done a lifetime worth of research on the dental fluid transport system, which is the dental fluid system that goes into and out of the tooth structure. In every tooth, there's hundreds of miles of dental fluid transport. So there's little microscopic highways that go into the pulp chain, and I've written a paper on this. It's not a long paper, but it's on my website, and so people will. What your body does is the pH of the blood, as we all know, has to be 7.35 to 7.45, which is the correlates to a pH level and correlates to a pH level in the bone and in the teeth. And so if homeostatically, if your body is acidic, your body knows enough to take and its alkaline levels will be increased by the mineral levels in the bone system or in the teeth. And so the shuttle system for this process is the dental fluid transport system. So if you're chronically acidic in your blood, your body is robbing minerals from Peter to pay Paul and depositing it in the blood for its mineral content to keep that balance within 7.35 to 7.45. This is a Jerry Tennant principle. Have you read the book Healing is Voltage? Are you guys familiar with that?
I've heard of it. I'll hold it up. I'll hold it up, Tom.
Yeah, Jerry Tennant is a brilliant MD. He's an ophthalmological surgeon who's written a book called Healing is Voltage. And this guy got very sick, and I walked in on his lecture, and he's talking, and Steven Sinatra was in there. He was in the middle. This is during the A4M, and he's got this film, these panoramic films up, and I said, those are dental infections. And this guy's an ophthalmologist, and he was talking about voltage and how voltage affects your teeth and the voltage affects your cellular membrane repair, blah, 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 blah. So in answer to your question, Tom, and I don't mean to be skirting the issue, but if the acidity of the body is acid, and with the exception of the stomach, which you want highly acidic, the dental system, the dental fluid transport system will act as a highway for minerals from the teeth into the blood. And so we see this during pregnancy. We see this during, people who are under a lot of stress, people who have a crappy diet, and it can happen, very quickly within a year or two. The way to reverse that is to add minerals back into the system, and that's with Silodin, concentrates minerals, and or brushing your teeth with a Sonicare system with mineral paste. And with hydroxyapatite paste, and you're rebuilding the enamel matrix, and same thing with the bony matrix.
Tom, I don't want to take too much more of your time, but we have an uber acupuncturist and naturopath that has what looks to me to be a tough question, but we'll ask it anyway. Could you comment on how to treat scars that are interference fields in the mouth?
Yeah, I would say I would refer them back to the naturopath. There is a machine I know called the OnDemand machine that will reduce scars and minimize scars. And I know I don't treat scars particularly, but I know that dental scars and scars, particularly like scars in the abdomen, will affect meridian lines and meridian function. And I would say that I think low laser light therapy, red light therapies, maybe detox protocols, but this OnDemand machine, which is a frequency generator, I think would suffice or be sufficient to help with that. But I would defer that question back to the guy who asked it, because maybe he knows somebody who treats that. But it would be a bioenergetic specialist. I know some of the chiro guys treat these types of scarring tissue issues with bioenergetics.
Tom, now
spell that OnDemand.
OnDemand. OnDamed. In fact, I just referred a patient to a place close to Utah in where was it? I think it was Chattanooga.
Yeah.
And I told my patient, because she's got all these scars from pregnancies, and she goes, I've got to get rid of these scars. And I said, well, the best way that I know how to do it is with an OnDemand machine, which I learned about from the A4M back in the day, back probably 2010, 2011, 2012. And I almost bought one, but they were $20,000, and I wasn't really qualified to. It was a whole new process. And I'm sure since that time there are other machines that break down scar tissue. But scarring is a very, 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 will block meridians, and Jerry Tennant talks about scar tissue a lot. Dental infections and apical abscesses and scar tissue.
So, Tom, you'll come back and present on more formally at some time in the future
I'd love to.
Oh, fantastic! I want to tell one sad story. Consult I did this morning with a lady who's in one of my wellness programs at a corporation. She's fine, but here's what she has: 32 years old, nursing a baby, a 3 and 4 year old at home.
Wow.
Currently has 3 root canals. Going for a 4th next week. She's in way the heck up in the middle of Michigan, and her white blood cell counts are 12,000.
Tell her not to get the root canal.
Believe me, I tried. She's from the Philippines, and so the communication, and I'm not trusted yet because I'm just the wellness guy, and normally I just go over the labs, and she has coaches, so I have the coaches. In this case, a coach you know very well, Tom, that's going to work with her to try to convince her to do not. And as a matter of fact, I wrote her a note today, the coach. My headline in bold letters was, "I got a tough one for you." But it's just like they're in that vortex, and wage earners up in an energy plant up in Michigan, and that's where they're going for. But the good news is, with folks like you, Dr. Harsfield, Dr. Carter, myself, we are pounding this concept of oral health and protecting the teeth and doing the right thing, not just trying to save that tooth. I've had many people that say for aesthetic reasons they're not going to pull out that root canal tooth, and I say, but you're already married. Who are you trying to impress? And then I go to the husband or the wife and say, hey, who's she trying to impress? It's like, pull that tooth, because health is a lot more. It's a lot more important than vanity. So, Tom, I really appreciate your time here tonight. There are lots of questions. I'll replay this as soon as I can produce it. And one last comment on a more positive note, but Dr. Lokensgard has the voice of an angel, and he's produced many CDs, and I am now using a snip from one of his songs that he produced 15, 20 years ago that I thought he produced because of the COVID crisis. And the main concept, the main line in his song is, "Wake up, America, before it's too late." So when you watch this video and I produce it, listen to the introductory and ending song clip, because that is Dr. Lokensgard.
Let me just correct a few things here, Tom. The song was written 27 years ago about the new age, called "Wake Up, America." It's actually, the song title is Trojan Horse.
Right.
And we just recorded it and just finished it in Nashville here, and there's multiple players. And there's some really talented players on this song. I wrote it. I'm doing the lead vocals, but there's a whole bunch of people from Nashville doing some backing harmonies. My son does the drums, and it was produced, and we're going to get some airplay out of it too.
But Tom, it was shocking how many times at the Truth About Cancer presentations that the concept of Trojan horse specifically was brought up, because that's what we have in this jab. It is a Trojan horse. So you predicted this 27 years ago, Tom.
Yeah.
Hats off to you, my friend.
Thank you, Tom. It's been an honor to talk to your guests, and I'd be more than delighted and honored to be a part of this.
No, excellent. We'd love to have you. And just so you know, we're going to end tonight because I have to go down and test out my pate. I haven't had dinner yet. And so, like I said, you'll have time for questions in the future for Dr. Lokensgard. Go ahead, Tom.
Thicken it up with Elmer's glue.
With what? Elmer's glue?
Elmer's glue.
I used eggs.
Gluten-free.
Yeah, no. Dr. Carter's gluten-free, but I'm not so much.
All right.
All right, folks.
Thank you both, guys. Thanks a lot. We appreciate it.
Thank you. Thank you both, Dr. Toms. Thank you.
Thank you, guys. All right.
Thank you.
Thank you.
All right, folks. Thanks so much.
Thanks for your time, both of you.
Bye for now.
Thank you, Dr. Tom.
Bye now.
Okay, bye-bye.